item number 31, which is a resolution recognizing November 2023 as National Hospice and Palliative Care Month. And I'd ask Shannon McQuat to come forward to the podium, and Supervisor Ortiz-Legg is going to do the honors.
Thank you. Resolution recognizing November 2023 as National Hospice and Palliative Care Month. Whereas hospice and palliative care empower people facing a serious or life-limiting illness to live as fully as possible, ensuring people dignity, choice, and a quality of life. And whereas the hospice model involves an interdisciplinary and team-oriented approach to treatment, including expert medical care, quality symptom control, and comprehensive pain management as a foundation of care. And whereas beyond providing physical treatment, hospice attends to the patient's emotional, spiritual, and family needs by providing family services like respite care and bereavement counseling. And whereas in an increasingly fragmented and broken healthcare system, hospice is one of the few sectors that demonstrates how healthcare can and should work at its best for its patient. And whereas a growing body of peer-reviewed research indicates that timely access to hospice and palliative care can decrease hospitalizations and emergency room visits and increase quality of life for patients and family caregivers. And whereas every year more than 1.56 million Americans living with life-limiting illness and their families receive care from the nation's hospice programs in communities throughout the United States, from more than 355,000 trained volunteers that contribute 16 million hours of service to hospice programs annually. And whereas hospice and palliative care organizations are advocates and educators about advanced care planning that help individuals make decisions about the care they want, and whereas Hospice of San Luis Obispo County, Central Coast Hospice, Dignity Health Hospice, and Wilshire Hospice provide hospice care and bereavement counseling respectively to individuals within the County of San Luis Obispo. Now therefore be it resolved and ordered that the Board of Supervisors of the County of San Luis Obispo, State of California, does hereby proclaim November 2023 as National Hospice and Palliative Care Month and encourage citizens to increase their understanding and awareness of care at the end of life and to observe this month with the appropriate activities and programs.
Thank you to the San Luis Obispo County Board of Supervisors for proclaiming November as Hospice and Palliative Care Month. My name is Shannon McCowett, and I am the Executive Director for Hospice SLO County. In SLO County, we are fortunate to have 3 medical hospices and 1 non-medical volunteer hospice, all who help those at end of life, their families, and the bereaved. Most people understand that medical hospice is for terminal patients who have less than 6 months to live and have stopped curative treatment. The patient has chosen palliative or comfort care at home or in a facility. These medical hospice services are covered by insurance, including Medicare. A non-medical volunteer hospice, such as Hospice SLO County, can begin supporting clients long before their illness becomes terminal because we do not charge fees or bill insurance and therefore are not bound by insurance restrictions. We therefore have more flexibility when and how we can assist clients and their families. For example, we can support a client with dementia, Parkinson's disease, ALS, cancer, and other illnesses for years. The client is matched with one of our trained volunteers who steps in to give caregivers a much-needed break. As you can imagine, caregiving for someone with a long-term illness takes its toll. Without the ability for respite and personal care, older adults aged 66 to 96 caring for a spouse have a 63% higher risk of death than non-caregivers of the same age. With the ongoing flexibility of our program, our trained volunteers give caregivers the time to get out of the house, go to doctor's appointments, and take care of their own health. And when the time comes that medical hospice is necessary, we educate our clients and work with one of the medical hospice organizations in our area to make a smooth transition. Hospice SLO County is also a community grief center. We support grieving residents regardless of when, where, or how their loved one died, or whether their loved one had been a client of ours. Our grief support offerings include individual and family counseling, support groups, and community grief response, where a counseling team will go to a place of business to facilitate debriefings and assistance to organizations or groups who have lost a coworker or member. Hospice SLO County is one of 17 non-medical hospices left in the country. And we are proud to have been serving this community since 1977. Thank you again for this proclamation and for allowing me this time to explain our services. Thank you.
Thank you. See if there's any additional public comment. Seeing none, close public comment. We'll bring it back to the board. Supervisor Arnold.
Yep, so I really want to thank you for being here, but most importantly, people listening, I know many of us and many of the listeners today have had experience with hospice or someone in their family, and it is amazing what you all do to improve the quality of life for people ending their lives, and then, as you said, helping the families and supporting the families going through that experience. So I just want to thank you again and thank all the volunteers who might be listening to this. It is amazing, the service you provide, so thanks.
Supervisor Ortiz-Lake.
Yeah, it's really nice to have you here, and thank you. I don't know what we would do without hospice, and I think it was really important for you to mention the fact that it's something that we've got to keep going and support all of us, because it's really critical for families. And Supervisor Arnold's correct that many of us have had the experience of losing our parent or loved one, and having that support system and having that knowledge to help us navigate that time is just very valuable, and so thank you.
Supervisor Gibson.
Thank you, Mr. Chairman. Indeed, I've had that personal experience with the end of both my parents' lives in recent years, and the work of those caregivers was extraordinary. So please extend my gratitude out to those who actually are at the bedside and with the families. They are exceptional human beings, and so grateful for their work.
I too will add that in, having experienced that with both my parents, so thank you for all you do. It's really, really tough work, but it is rewarding at the end if you know what you're doing, and we appreciate all you do. Thank you. With that, item is concluded.